These exchanges are supposed to be up and running by September 1st of this year because the bill, the Affordable Care Law, takes effect in January of 2014. So these exchanges are supposed to be ready to roll, and there's not been a lot of guidance so far from the federal government about how to design them. There are an awful lot of folks who think this was the intent, that the states would have to come up with these marketplaces themselves. The federal government would not provide a whole lot of guidance because the federal government didn't want to be stuck running the system. And also there was a provision in the law allowing states that set up exchanges to receive certain tax benefits for and subsidies for policies sold through the exchanges that are not available if the federal government runs the exchange. So the thought was, the states will take advantage of this. We're offering them something for free. We're offering something close to home. We're offering them the opportunity to experiment in the laboratories of democracy and all that sort of thing. But states largely have said no because, for one thing, they're not really sure exactly what coverage they have to provide. That's part of it, and that's why about half the states have chosen not to get involved. And secondly, a lot of the states, including North Carolina, that have decided not to get involved have said, we really aren't going to have that much choice. I mean, there's going to be very, very specific guidelines as to what the policies have to offer in coverage. So it really doesn't make that much difference if we operate an exchange out of Raleigh or if it's operated out of D.C. because they're largely going to be offering the same products.